Hi everyone, welcome back to my YouTube channel. Today we are going to talk about periodontal ligament. And here at the side you can see the diagrammatic representation of cross section of teeth that is showing the purple color periodontal ligament for the reference. For starting the video with introduction, periodontal ligament is a specialized connective tissue that plays a vital role in supporting the teeth within the jawbone. It forms a soft fibrous connective interface between the cementum covering the root of tooth and alveolar bone of the jaw. PDLF helps maintain the tooth in its socket while also allowing it to withstand the forces of mastication and functional movements. Its dynamic and adaptive nature make it crucial to both dental health and orthodontic treatment. Definition of periodontal ligament. Periodontal ligament is a highly vascular and cellular connective tissue located between the cementum of tooth root and alveolar bone. It connects the tooth to the surrounding alveolar bone and serves multiple roles, including mechanical support, sensory feedback, and nourishment of periodontal structure. Location and extent. Periodontal ligament occupies a narrow space between the root of tooth and the wall of alveolar socket. It extends from cervical region near the gum line of the tooth down to the apex of root. This ligament surrounds the entire root surface and is found in both primary and permanent dentition. Structure of periodontal ligament. Periodontal ligament is composed of fibrous connective tissue with collagen fibers. It also contains cells that include fibroblasts, cementoblasts, osteoblasts, and defense cells. It also contains ground substance that is rich in proteoglycans and glycoprotein, and also contains nerve fibers for sensory input and blood vessels that provide nutrition and remove waste. Principal fiber groups of periodontal ligament. Collagen fibers in the periodontal ligament are organized into specific groups based on their location and direction. These groups include alveolar crest fibers, as you can see here in diagram. They extend from cervical cementum to the alveolar crest. Second is horizontal fiber, as you can see in diagram. They run perpendicular to the root surface. Third are oblique fibers. They are the most abundant fiber that extend obliquely from the bone to the cementum and resist vertical forces, as you can see here in the diagram. And the most of the area of the periodontal ligament is oblique fiber. Then we have is apical fiber that are located at the root apex region, and they provide resistance against stripping and extrusion. Next type of fibers of periodontal ligament are interradicular fiber, as you can see here in diagram. They are located in the furcation area of multi-rooted tooth. These fibers help suspend the tooth and absorb mechanical loads. Cells of periodontal ligament. Periodontal ligament contain various cell types that maintain and repair the ligaments and surrounding structures. They include fibroblasts, that is the most numerous cell. They produce and remodel collagen fiber. The second type of cell is cementoblast, that is involved in formation and repair of cementum. Third type of cell in periodontal ligament is osteoblast and osteoclast, that is responsible for bone formation and resorption. Next type of cell are epithelial cell rhabdomyolyses, that are remnants of harping epithelial root sheet. It can become cystic under pathological condition. Next type of cells is undifferentiated mesenchymal cells that have potential to differentiate into other connective tissue cells. Next are defense cells that include macrophages and lymphocytes that are involved in immune response. Functions of periodontal ligament. First function is supportive function. Periodontal ligament anchors the tooth to the alveolar bone and cushions it against occlusal forces, preventing damage to the bone and other supporting tissues. Second function is sensory function. Periodontal ligament contains sensory nerve endings that detect pressure and pain, playing a role in proprioception, that is sensation of tooth position and movement. Third function is nutritive functions, and blood vessels in the periodontal ligament supply nutrients to the cementum, alveolar bone, and ligament itself. Fourth function is formative and remodeling function, as the cells of periodontal ligament are involved in continuous remodeling of cementum and alveolar bone, especially in response to force or injury. Next function is protective function, as the periodontal ligament helps absorb shock from chewing and guards the tooth and surrounding structures from mechanical injury. Development of periodontal ligaments. Periodontal ligaments develop from the dental follicle which surrounds the developing tooth germ. As root formation begins, mesenchymal cells in the dental follicle differentiate into fibroblasts which produce collagen fibers. These fibers gradually orient themselves between the forming cementum and alveolar bone to become the periodontal ligament. Age changes of periodontal ligament. As a person ages, the periodontal ligament undergoes several changes. First is reduction in cellular activity. Second, decreased regenerative capacity. Third change is fibrosis or thickening of collagen fiber. Fourth change is narrowing of peridial space. Fifth change is calcification or presence of cementicles that are small calcified bodies within the ligament. Despite these changes, peridial often maintain its function unless compromised by disease. Clinical significance. First is orthodontic treatment. As we know, peridial plays a central role in tooth movement. Orthodontic forces applied to a tooth result in remodeling of peridial, allowing the tooth to move through bone. Second significance is periodontal disease, as inflammation of periodontium can lead to destruction of peridial and eventual tooth loss if untreated. Third significance is dental trauma, as the periodontal ligament can become inflamed or ruptured due to traumatic injury affecting tooth stability. Fourth significance is tooth extraction and healing, as during tooth extraction care must be taken to avoid damaging the periodontal ligament excessively. After extraction, peridial laminates often contribute to the healing process of socket. Fifth significance is regenerative therapies, as advances in regenerative dentistry aims to restore lost peridia using growth factors, stem cells, and scaffolds. Conclusion of this lecture video. Periodontal ligament is a vital multifunctional tissue that plays an essential role in maintenance and functioning of tooth. Its unique ability to support, nourish, and respond to forces make it an integral component of periodontia. A deep understanding of peridial is crucial for diagnosing, preventing, and treating periodontal disease as well as for planning orthodontic and restorative procedures. And this was all about periodontal ligament. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.